Good afternoon, everyone, and welcome to this Healthcare Support Worker Indeed Hiring Event webinar. My name's Clive Myers, and I'm the Director of Public Sector here at Indeed. I would like to start off by welcoming you all. It's great to see you here today. Just to confirm, as I said in the chat at the start, as this is a webinar, if you're an attendee, unfortunately we can't hear or see you, but what you can do is host any questions that you have in the Q&A at the bottom of the Zoom software, and we will answer as many as we can today, but I'll go into that in more detail in a bit. I'd like to start off with some housekeeping, if that's okay. So I'm going to start off by introducing the attendees that are here from the NHS for the event today. So we have Jenny Stone, who's the Talent for Care Relationship Manager at Health Education England. We have Catherine Stevenson, who's the Senior Project Manager for NHS England. And we have Kate Gardner, who's the Head of Clinical Productivity for NHS London. Just so you're all aware, my colleague Simon, who will be posting in the chat functionality, has posted a link for you guys to register with. You will see it in the chat, and the event code is 75721. So Simon will post that throughout the course of the event, so don't worry just yet. You guys are more important, but if we can try and do that at some point, that would be great. What we're going to do is Jenny has kindly come along to share about the care certificate, and then we have Catherine, who's going to be doing a bit of a Q&A with me today. I've got some questions that I prepared for Catherine, but then also what we're going to do is, because this is an interactive session, we're going to get some questions from you guys as well, and answer Catherine that as well. And then we're going to have Kate speak about the healthcare support worker role, give you some overview of the role, what it's about, and give you some great interview tips and how we're going to progress moving forward. And then I'll close the webinar with rounding up on the event and highlighting the next steps for you guys. So thanks very much, everyone, for coming once again. Really appreciate it. And just to confirm one last time, if you have any questions, please put them in the Q&A at the bottom, and we will answer as many as we can today. And the questions that we can't answer today, we'll be following up on an email to all of the attendees with all of the questions and answers after the event. So with that, it gives me great pleasure to pass the meeting over to Jenny Stone, who's going to talk more about the care certificate. So over to you, Jenny.
Thanks, Clive. Thank you. Hope everyone can hear me okay. So good afternoon and welcome to the event. As Clive said, I'm Jenny Stone. I am an apprenticeship relationship manager in the Talent for Care team at Health Education England. The Health Education England is the education arm of the NHS, if you wasn't sure who we were. So I don't work for a hospital, but I work on behalf of all the hospitals in London from the education perspective. So as you can see here on the first slide, so I'm going to give you an overview of something called the care certificate. Now, the care certificate is something that you would obtain in your first few months of being a healthcare support worker in the NHS. Some of you on the call may already have it, or you may have already done some work towards a care certificate. So I will just give you an overview. The next slide, please. So, as I said, I'm in the Talent for Care team in Health Education England, and our strategy is get ready, get in, get on, and go further. You are all already in that get in box, in that grey blue box, because you're here today. You're getting ready to join the NHS and you want to be part of our big family. The next point would be getting, which is opportunities for you to start your career in a support role and come in and join us to support our staff, our nurses, our doctors, allied health professionals. And then you have an opportunity to get on, which is supporting people to do the best they can in the job they do, including occupational competence. And the get on is the first step with the care certificate. We then have go further. So that's about how we invest in our staff, and we develop all of our staff to move up the career ladder within the NHS. So for me, I've been on this ladder in the NHS for 22 years now. I thought about it, I got ready, I got in, got the job, and then I get on. I've done numerous qualifications through the NHS, and I've stepped up to go further. So I just want to play a short video for you now about the care certificate and about how these steps fit in. So I think hopefully that will start playing, because I think we've gone back to the screen. Yep, here we are.
Get ready. So, you've decided to take your first step towards a career in the NHS. Welcome. You've chosen an exciting time to join one of the best health services in the world. As part of our team, you're guaranteed hands-on, world-class training and plenty of opportunities to thrive and progress through your career. Get in. Our healthcare support worker roles are a great entry point into the NHS and can lead to a lifelong career. You'll work alongside a passionate team who can help and support you to gain new skills, and you'll undertake a whole variety of tasks depending on where you're based and what kind of setting you're in, such as conducting patient observations, and next you'll be supporting patients through their treatment and making them feel comfortable and at ease. As a healthcare support worker, your training will include basic care skills, and you'll also work towards the care certificate, which will help you get on. Before you begin to work with patients, your training will start immediately with the care certificate. The care certificate is an induction process through which you will develop skills fundamental to delivering high-quality care. A blended learning approach enables you to take e-learning modules and hands-on training across embedded standards. These standards will help you to understand your role and personal development more. You'll learn about duty of care and why it's important, and you'll receive practical training such as basic life support so that you can conduct key tasks to enable good patient care and safety. The care certificate will lay the foundation for you to build on and develop
We seem to have a few issues with that video.
qualifications and progress. The experience and qualifications you gain will help you to plan your next career steps, whatever they may be. And if you'd like to be a career healthcare support worker, that's great. You'll still be able to progress and develop in your role. You'll be encouraged to take qualifications and increase your knowledge and skills. Plus, as you gain experience, you're likely to be given more responsibility. You may even have the opportunity to become a team leader, supervising other clinical support staff. Go on, sign up to the care certificate and step into an exciting world of caring. Get ready, get in, get on, and go further.
Thank you. Just wait for the slides to come back up. Thanks, Simon. I think Simon's driving the slide, so thank you very much. So I hope that video gave you an overview of just how supportive we are when you join the NHS and how we want to make sure that you join that ladder to be able to go further. Next slide, please. Thank you. So as it just said in the video, and I said earlier, Get On is included in that care certificate. So you can see here the care certificate is part of Skills for Care, Skills for Health, and the NHS England, Health Education England. Next slide, please. So the background to the care certificate. So this was introduced in 2015. Some of you may not have heard of it. Some of you may well have done it or already started to look into doing it. So 5 years it's been around, and it was a result of a review that was taken place following the Francis report, which found some failings that happened in mid-staffs. Again, you may have heard of this back in 2015 or prior to that, when the issues happened around in mid staffs. So this is the driver behind it, and this is where the conception came of the care certificate. So the aim of it is to ensure we have a consistent approach to induction, so that no matter what hospital you join, you get the same content within the care certificate that I will talk about in a minute, and to ensure that you are competent, caring, and we have a compassionate workforce. So our main priority in the NHS is our patients and high quality of care. So it's not, and it's also to help you. So you're not going to jump in at the deep end. You're not going to be pushed in that deep end. You are going to be supportive completely all the way through coming in and joining the NHS, and we're going to make sure you have everything you need. Next slide, please. So what is the care certificate? It is the minimum training and supervision and assessment for staff who are new to care. Now, I've seen some people write in the chat that they're already working as healthcare support workers out in the community or in care homes. And you may well have done the care certificate, but if you join one of our trusts as a healthcare support worker, you will still have to do the care certificate or some sort of intense induction to make sure that you are safe to work with our patients. It is delivered as part of induction, and the care certificate is used to start off your career in healthcare. It ensures that people joining have the relevant and appropriate training to support you and and there's a workplace assessment to ensure that the care that you deliver is safe, and when you move on, you are able to deliver care out of the sight of more experienced workers, so that if you're just pushed into a ward and asked to do something and you're not 100% sure what to do, that's not going to happen, because we're going to make sure that you have all the knowledge and skills that you need to be able to do that job. So it provides a foundation for people working in healthcare support roles. And as I said before, it's about the compassion and caring service of the NHS. It applies to new staff who are new to care across all health and social care sectors. And it's for roles that have direct contact with patients that need care and support. Next slide, please. So the context of it is it has 15 standards that have to be completed. Now, this involves knowledge of learning, practical skills and development. And by doing that, they'll do workplace assessments. And all the standards completion of all the 15 standards are required to attain that care certificate. And the care certificate is based around the 6 C's of care. So care, compassion, competence, communication, courage, and commitment. So this is the fundamentals behind it all, but we need to make sure that you have the 6 C's of care. Kate is going to talk about your interview tips later, and how to apply to the NHS. But one of the things that I would recommend is that you definitely look up the 6 C's of care, along with the values of the hospital that you're applying to. Next slide, please. These are the 15. I'm not going to read them all out, but you can see there it includes your personal development, it includes understanding your role, it includes safeguarding, and basic life support as well. So an example of that is that you're not going to be pushed into a ward, and unfortunately someone might have arrest and have and their heart stop. You're not going to be expected to jump in and do basic life support without having that competency signed off. Now, sometimes that's not always something that you can practice on, fortunately. So what we do there is we do simulations. So you would use something called, I'm sure some of you might have heard of Resus Annie, where you get to practice on a dummy to make sure that you are fully competent if it arises. It also contains health and safety, and the most important one at the moment, which is number 15, infection control and prevention, which is absolutely paramount at the moment in the situation that we're all in, and why we're having to do this via Zoom today. Next slide, please. So we often get asked, does this replace your staff induction when you come to an NHS trust? It doesn't completely replace your staff induction. The care certificate is part of a structured induction. You will do an induction with everybody else that's joining the hospital on that week, on that day. But anyone that has direct patient contact will then go into a separate group to do the care certificate. And then you would do this over the following 3 months to ensure that you are competent. So you would still get your fire safety, your health and safety, data protection and all things like that. But this would also be in addition with caring for patients. Next slide, please. It normally takes about 12 weeks. Some of you may have already done the care certificate. So if you can bring along all of your evidence of what you've obtained already, then some of it can be what we call APEL'd across, which is where we look at your relevant learning and experience, and we might be able to sign off some of it to make it shorter than 12 weeks. So the length of it does depend on the employer as well, but it also depends on your experience. And we would not expect you to do this in your own time. This would be in working paid hours. Next slide, please. So how is it achieved? It's achieved with theory and applied practice within the work environment. So there is some e-learning, and that on the video, the link is to the e-learning. But that doesn't mean to say you can just do an e-learning package. You do have to have applied practice. So you have the theory behind it, and then you have to put this into practice. So once you've completed the theory of the standard, you need to apply that learning into practice. So as I mentioned before, some of the standards may well have an element that you're not able to experience every day. So for example, basic life support, thankfully, isn't something that you will experience every day. So that may be you'll learn that via a simulation technique. And you will apply the theory every day in your work. It's not until you've practiced and been assessed that the standard is signed off and complete. And it has to be completed and assessed before you can work out of sight of your supervisor. And again, that's for your safety as well as our patients. So it's nothing to, even if you've got a wealth of knowledge and experience, which I'm sure some of you have, it's about your safety to make sure that you're safe and that there isn't any errors or mistakes. Next slide, please. So once you've finished the care certificate and evidence of having met all the standards, then you can then work towards some regulated qualifications and possibly apprenticeships in health or social care. So as I said before, one of my main jobs is around apprenticeships in healthcare, of which we have hundreds. So there is a healthcare support worker apprenticeship at a level 2 or a level 3. And then you could progress on to a level 5 or 6, which are foundation degrees, which include nursing, midwifery, occupational therapy, physiotherapy. I could sit here and list off hundreds, but I'm not going to because I could take up the whole session. So it is the responsibility of your employer to award that care certificate. Now, they will keep a record of your achievement, but one of the most important thing is that you keep a record of this achievement so that when you go to another hospital or another care setting, you can take this with you. And then we also have a code of conduct for healthcare support workers. And this is about being accountable, making sure that you give patients their dignity, their right and privacy, and that you work in collaboration with your colleagues and you communicate well. You respect the right of people's confidentiality, and that you continue through your personal development, professional and personal development, and also that you uphold and promote equality, diversity and inclusion as well. So all of that's included. Next slide, please. So I have mentioned this before, but the go further stage. So on completion of your care certificate, you will be given opportunities to develop and progress your healthcare career. It said in the video, you could become a team leader or a supervisor. You don't have to, but the option is there for you. and in-house training courses. I wouldn't be in the situation I'm in now talking to you all, and have this opportunity to promote the amazing things that we do in the NHS and the education that we can offer you, purely because I've done in 22 years lots and lots of in-house courses, and I've grown through that ladder, and I've done lots of qualifications and everything that was offered to me. So one of the qualifications you might be offered is an apprenticeship in healthcare support. And you can go on to become one of our registered nurses, which is really big at the moment. We've got a really big drive on that. So a lot of our existing healthcare support workers are now joining that registered nurse apprenticeship. And you guys are going to come in and be the future registered nurses and be given that opportunity. So the last thing I'm going to say to you is that the opportunities are endless if you give us, come and join us, come and join the family of the NHS, and look after our patients, and we will look after you by giving you the care certificate. I think that was my last slide. Thank you.
Thank you so much, Jenny. That was a really great insight into the care certificate and all of the help and support that the NHS provides when people decide to join the family, as you just said. And speaking of joining the family, Simon, if we could stop sharing the screen now, that would be great. Thank you. I'd like to bring in Catherine, if I may, who currently works at the NHS and previously was a healthcare support worker. Catherine, are you there?
I am here, and I did turn my video on, but I don't know how technology works, so I'm sorry about that.
No worries. Catherine, we can hear you. That's the most important thing now. How are you today? You good?
Yeah, I'm very well, thank you. Really pleased to be here, so thank you for having me.
No worries. Thanks for coming. So probably my first question, Catherine, is what made you decide to become a healthcare support worker?
So I became a healthcare support worker because I knew that I wanted a flexible job for holidays and the occasional weekend when I was at university. And I also knew that I wanted to work with people and do something where I could help people. And beyond that, I had no idea what I wanted to do, if I'm honest. And whilst I was looking for a job, I actually bumped into one of my mum's friends who was a nurse. And she suggested that I had a look at the different nurse banks that some of that local hospitals had for healthcare support workers. And my mum had actually been an auxiliary nurse many moons before when she was at teacher training college, and so she could sort of explain the role to me a bit more, and the more she told me about it, the more I thought, actually, yeah, this is something that I'd really like to do.
Brilliant. And obviously from that and what you've just said, you had no previous healthcare experience. Was that a barrier for you?
So I didn't have any caring experience. I looked after my grandma a little bit, who'd had dementia, or who has very advanced dementia, and I knew a few things about myself. So I knew that I was a problem solver, and I knew that I'm very proactive as a person, and I also knew that I'm probably quite good at chatting to people, but I wanted to improve that. And so I thought, you know what, I've definitely got something to offer. And I also talked a little bit in my interview about the fact that I'd looked after my grandma, and I recognised that it's very different caring for a stranger than it is caring for your loved one, but the basic skills that you need to deliver that care are the same. And so I think for anyone listening, if you have had that experience, it's definitely something to talk about, because it's a transferable skill.
Yeah, definitely. And Jenny just delivered the fantastic presentation about the care certificate and showed all of the help that people get. But obviously when starting a new career with no previous experience, it can be quite daunting. What sort of support did you get when you first became a healthcare support worker?
So I became a healthcare support worker many moons ago in 2010, and I was daunted because I was 19. It was my first real job, and it was before the care certificate had actually come in. So I was trained in 3 different ways in 3 different trusts. And I think the thing that has been overwhelmingly true in every trust that I've worked at is that the people that you work with in the NHS are incredibly dedicated, and therefore they give you the time that they can to train you up. And aside from some of the things that Jenny talked about in terms of basic life support and moving and handling training, a lot of the training that I got came from particularly one ward that I worked on. There was a young sister there, and she was really keen on making sure that everyone could pull their weight effectively on the ward. So any free moment that she had, or the nurses that were working under her had, they spent time kind of upskilling me. And the wonderful thing about the care certificate is that a lot of those additional skills that I got from that are now involved in the care certificate. So you get that now as part of your induction. And I think the thing that has really changed in a really positive way over the last 5 years is the amount of progression that healthcare support workers can go on and into now. So Jenny talks loads about it, but the fact that there are now apprenticeships for healthcare support workers, and there are nursing associate roles, there are assistant practitioner roles, and there's routes into being a nurse, being a midwife, or if you take a slightly unconventional route, which I did, other parts of the NHS, so project and programme management. So yeah, I think that whilst it is daunting, there are a lot of people to offer advice and support, and they're the best people to learn from.
Yeah, definitely. And if I can add to that question, you talk about the dedication and passion of NHS employees. You know, I've had the fortune of working with the NHS for the last 8 months now on quite a full-time basis. And I have to say they are the most dedicated and passionate people I've ever met. And Jenny mentioned the word "come and join the family." It really does feel like a family every time I speak to somebody at the NHS. Just a quick question, Catherine. You mentioned you were 19. Now, I've had a chance to look through some of the Q&As, and we're going to answer some questions from the people on this webinar today shortly. But is there any kind of age restrictions to become a healthcare support worker?
I think you have to be over 18, but beyond that, no. And I think one of the real beauties of it is a role that you can come to in many different phases of your life. And because of the variation in settings that you can do the role, that I would recommend doing some research around different areas. But for example, in some roles it will be quite physical, and in other roles it will be much more around talking to people and spending time with people, and kind of helping them helping support their well-being, or helping them to live independently. So I think there are a whole host of different roles to suit different ages and to suit different capabilities.
Awesome. So for example, somebody asked them, they're 65 years old, so they could still apply for a healthcare support worker role?
As far as I understand, yeah.
Brilliant. Okay, that's great. And if you can, I know it's a while ago you were a healthcare support worker, but can you talk me through what a day in the life for you was as a healthcare support worker?
I can. I don't think there's such a thing as a day in the life. I think every day is different, and that is one of the real beauties and benefits of the role. So I worked in 3 different areas. I started off working in mental health, and a day so I worked in acute mental health wards, so people that had been sectioned or required quite intense support, and a day in that life would be chatting with people, often on a one-to-one basis, just kind of like managing their support and doing their observations to make sure they were physically well as well. And then also with some of the wards were things like dementia, where it was helping with feeding and delivering personal care. I then worked in acute adult wards, so like for want of a better word, your average hospital, and that was much more physical. I think it's the fittest I've ever been in my life, if I'm honest, because I was on my feet for 13 hours a day. But that was much more around moving and handling patients, helping them mobilise, or helping them with their rehab if they'd had, for example, like a hip operation or a knee operation. Again, it was spending time and chatting to patients, and it was also things like making beds, taking blood pressures, measuring blood sugar levels, and things like that. So really much more around delivering personal care, and also, of course, working with doctors and nurses and other healthcare support workers. And then the final area that I worked in was again in a hospital, but in the outpatients clinics. And that was again a different set of skills, because that was more around managing clinics and making sure that they were running smoothly. So going between doctors and patients, making sure that all the correct paperwork was there, working with the reception staff, and yeah, just every day is different. And also every day, because I worked in bank, so I think one of the things to talk about is that as a healthcare support worker, you can apply to have a role where you're attached to a specific ward or a specific setting, or you can opt, if you want a bit more flexibility within the role, you can opt to go on the nurse bank, which is what I always did. So within that, you're part of a staffing resource where you're attached to a hospital. So for every shift that I did, I was on a different ward with a different team. So I got really good at teamwork, and I got really good at kind of just being able to fit into a situation. And again, that's where that family comes into play again, because colleagues are really supportive, because everyone wants to deliver the best possible care. So again, that added another level of variation.
Yeah, definitely. And when you speak there, I sense the passion, but also can see how rewarding the role can be as well. Would that be your right thing to say?
Yeah, so not to sugarcoat it, it's one of the most challenging roles I've ever done, but because it's so challenging, it's got such a higher level of reward. And I think that there's something so wonderful about being able to directly help people, and not just patients, but their families, their friends, like doctors and nurses, and actually being able to see like the improvement like immediately. It's like a feeling like no other.
Yeah, I see that. Thank you. And I know you've mentioned that you're now no longer working in the healthcare support worker role. So it's a bit of an open-ended question, but has your experience of working as a healthcare support worker helped in your decisions on how you decided to develop your career, as an example?
I think it's not just helped, it's determined my career in so many ways. I always joke that it's kind of like my trade, because I've never worried since being a healthcare support worker, or having had the experience of being a healthcare support worker, about getting a job, because there are so many different trusts that need people. And it's also been the backbone of my career. As I said, I did it when I was 19 and I didn't know what I wanted to do with my life. And being on wards got me interested in policy and understanding how wards work and hospitals work and things like workforce planning, and just kind of wanting to help innovate where I could, and also wanting to make sure that like I could improve services for people. So that it's really set me on that trajectory. And I also I was really lucky in that it's a job that I've been able to do in many different stages of my life. So I did it while I was at university part-time, I've done it full-time, I've done it alongside other jobs, and when I was doing my master's, because I was doing it actively, I focused my dissertation on it and looked at how you could develop the role of healthcare support workers. So it is something that I'm really passionate about, and it's always got people interested in my CV, which I think is perhaps because I worked in health and care policy, but people are interested because you've had real life experience of helping people and dealing with some of the challenging situations that come from that. And now it's come full circle, because part of my role as a senior project manager for NHS England is looking at professional development for healthcare support workers.
Yeah, great. And the final question for me before I go to the questions from the audience, and there's a lot of people on this webinar right now, not to worry anyone. Why would you recommend becoming a healthcare support worker? What's the main things?
I think it's all the things that we've talked about, to be honest. I think people have so many transferable life skills, and I think as a role it really gives you the opportunity to bring that life experience and those skills and turn it into a career. I think it's really it's the experience that you get also, like, it's really shaped me as a person, and it's been a really important foundation for everything that I've gone on to do. And I think that, as well as being part of the NHS family, that experience of delivering and helping people, and also like it can be really challenging and it's very fast paced, and all of the skills that you learn, they stand you in good stead throughout your life going forwards.
Yeah.
So I think in that sense it's really valuable, and just the reward and getting to work with nurses, and also now because there are so many more career pathways, it can start you on your journey to becoming a nurse, I work with healthcare support workers that were about to go into medicine, so they wanted that experience of delivering care to patients before they trained as doctors. I've met people that did it and were like astrophysicists. Like, I think it's just such a versatile role, and it's such a versatile role given that it is like the beginning of your career, or the beginning of our career. So that's why I would recommend it.
Brilliant. Thanks, Catherine. And then we've got about 5 minutes until I'm going to ask Kate to chat with some tips and advice on interviews and so forth. I've got some questions from the audience that I'm going to ask you, if that's okay.
Yeah.
So just to pick a few out. So Samantha asks, do you need relevant qualifications in care?
So most places that I applied to, you needed to have like maths and literacy skills. But in terms of qualifications for care, no, that's what the care certificate is, and it provides an induction process that is the founding of your skills within the health and care sector. So no, you don't have to have specific health qualifications.
Great. And then Sam asks, which is kind of a similar question, but do you need previous experience to start this role?
No. If you have previous experience of caring for your family members, I would talk about that, because I think that's a really important experience that you can bring to the role. But for the healthcare support worker role, you don't need any caring experience. Great.
Thank you for that. Candice asks, when you apply for a care certificate, do you have to apply for that first before you apply to become a healthcare support worker?
No, you don't. So once you've been offered a role, they will probably send you information on how to have a look at the different e-learning modules, which is public access, so anyone can sign up to. And then that will be your induction process, so you don't have to do it before. If you're interested, you can have a look at it, but you don't have to do it before.
Okay, great. Constance asks, having done the care certificate, do I need to repeat it?
That is a question that I think most trusts will perhaps reassess you if you've already got it, just to make sure that you're up to scratch with your competencies. But I think it would be a trust level decision.
Brilliant. Thank you. And just a couple more from me, if that's okay. Samia said, which is a great question, what are the, and I know you spoke about at the start of your career, you wanted flexibility. What are the shifts like working as a healthcare support worker?
They differ so much across different clinical settings. So when I worked in mental health, I did 7-hour shifts. So they would either be a morning or an afternoon shift. When I worked on wards, it was a full day, 13 hours. So from like 8 to 7. But also when I worked in outpatients, it was more like 8 till 4 or 8 till 5 or 10 till 6. And that was just the settings I worked in. There are so many other settings that you can work in. So I think really it's a discussion to have with the employer, but also if you do want that flexibility, I would recommend having a look at the nursing banks as well.
Yeah, great. And then the final question from me before I pass over to Kate, which is a great question, and I'd like to personally thank Jack for the question. He said, I'm nervous about the interview. I've looked after my mum and she has bipolar and depression. I was her carer. Will that help me towards the job?
I think that experience is incredibly valuable experience for this role, and I would encourage you to talk about it. I think having that experience, you will be able to do you'll have a lot of the skills that you would need to do the role. So I would definitely encourage you talking about it in the interview. And also, I always get nervous before interviews. I got nervous before this, so I think that's just completely normal.
Not as nervous as I did. Catherine, thank you so much for coming along this afternoon and answering those questions. I think you've delivered such a great insight into the role and everything around it, and given us a real basis for what today is all about. So thank you so much.
No, thank you so much for having me. It's been a real pleasure.
No worries. And just to put the icing on the cake of the healthcare support worker role, I've now got Kate, hopefully, who's going to discuss things regarding the role and the overview of the role, some interview tips and progression moving forward. So over to you, Kate.
Thanks. Can you hear me, Clive? Yep, great. Thank you. Hi, everybody, and thanks for inviting me to present today, Clive. So my name's Kate Gardner. I'll just do a bit of an introduction to myself before I get into the presentation. I am a nurse by background. I work at NHS England at the moment as the head of clinical productivity, but first and foremost, I'm a nurse and I've worked in the NHS for about 20 years and have worked predominantly in hospitals, working my way up the career ladder, working as ward manager and matron and lead nurse in a number of organisations. So I've worked with a lot of healthcare support workers, and actually when I was doing my nurse training, did a healthcare support worker role myself as well. So next slide, please. So yeah, I mean, I think Catherine has spoken in great detail and really eloquently about the healthcare support worker role and given you a real flavour and insight into it. And I think it's just something for you all to consider as a real opportunity and a real first step into the NHS. And it can be your career for life if that's what you like and you enjoy it when you get there, or indeed it can be an opportunity for you to step off and find some new and other interesting options such as nursing within the healthcare sector. In terms of healthcare support working, there's a number of different areas that you can work in. So we've talked about working in the hospital setting, working on adult wards, but you can also be a healthcare support worker, as Catherine said, in a mental health setting. You can work in a maternity unit as a maternity support worker. There's a number of roles in what we call allied health profession, and that they're the therapies, so occupational therapy or physiotherapy, they have assistant roles within their teams as well. You can also work in children's or paediatric units, and we can also offer roles in the operating theatre. And you'll also find these roles out in the community setting as well. So I think it's worth, when you're looking and doing your job searches, to have a look more broadly at healthcare support worker roles. And they're really key and fundamental to delivering care to patients. We can't do our jobs as nurses without the support of our healthcare support workers, who really work so closely with the patients, delivering one-to-one care, really understanding the clinical needs of the patients and feeding that back to the registered nursing staff. So it's really important that you can work as part of a team. But it's a really, really great first step, as I said, into healthcare. Next slide, please. So just some examples again of roles that you'll see. So you might hear healthcare support worker be called a number of things, and one of them is a healthcare assistant, which is interchangeable with healthcare support worker really, and that's your role that's working on an inpatient ward really. As I said before, you've got maternity support workers working at the front line and looking after families as they embark on their journey into new parenthood or subsequent births. And then also the occupational therapy support workers. So these are the therapy roles. There's another one on the next page called a physiotherapy assistant as well. And these two roles are working with our physios or our occupational therapists, helping people get back on their feet either after an injury or they've been into hospital, and a really important role. So you're working closely with people as they rehabilitate and recover from their illnesses or injuries. Next slide, please. And then a couple of other different roles that you might see around as well are speech and language therapy assistants. They're probably not as common as some of the other ones, but certainly worth keeping an eye out for. And you're supporting then the speech and language therapist for patients who've got problems with their communication, they're having difficulty swallowing, and may need to be fed but via a tube into their tummy because they can't swallow properly. So there's lots of support that these patients need, and as a therapy assistant in this area, you'd be working really closely with these patients. And lastly, an interesting area as well, which is a radiography assistant or an imaging support worker, and this is working in an area where they're undertaking X-rays and CT scans and MRI scans, and you're there working closely with the radiographers and radiologists as they undertake these tests on the patients, and you're supporting the patient again one-to-one as they're going through that testing process. So just some really interesting and different roles that are worth thinking about. I think when we talk about healthcare support workers, It's a really broad term that describes a number of different roles that you could be looking at applying for in the NHS. Next slide, please. So I wanted just to give you some of my top tips for applications and interviews, because I appreciate that almost all of you on the call will have put a job application in before and been to job interviews. So I don't want to tell you how to do the things you already know, but I just wanted to give you some views from my perspective as somebody who, one, has to read the application and to shortlist for an interview, and then also prepare questions and interview people, and how to really get your foot in the door. And I think I've seen some questions already come through for people saying, you know, I don't have any experience. How am I supposed to, you know, get my application noticed, I guess. And I think I'd say first and foremost is read the advertisement and know what you're applying for. So sometimes when I'm doing shortlisting, I can see that people have just cut and paste information into their application, and so it's a really generic kind of, you know, I'm looking for this job, you know, and there's no specific information about what it is that's drawn you to the particular post you're applying for. So I'd suggest being really specific when you're answering the question in the application as to why you wanted to apply for this job. What is it about that particular unit? And do a bit of research about the area that you're applying for, so that you can really answer the question as best you can. Make sure everything's complete on the application form, that you haven't missed anything out, because it looks like you haven't taken care and time to go through the application. Make sure you spell check it, or if you can, get somebody to review the document for you. But really, I think if you've got, important in the application is, as Catherine said, if you've got any past experience in terms of caring, that's great. You can add that into your reasons for applying for the job. But equally, if you don't, I think it would be really helpful for the person who's shortlisting to describe the kinds of jobs that you've had before and the skills that you've acquired in those jobs that can be transferred into a healthcare support worker role. So one of the ways in which you can do that is by thinking, if you've done something like hospitality, you can look at how you've worked in customer service, and so you've worked with people. Sorry, my screen's just gone off. I'm just trying to fix it. So you've worked with people. You've got good people skills. You know, you've worked in challenging situations where you've had to, you know, answer difficult questions, and really thinking outside the box of the things that you've done. So have you worked in a big team before? Have you had to have direct interactions with people when you've been working? And really try and pull those out and put them into your application, so that the person reading it can really understand that you've thought about this and you're going to bring some skills to the job. I think one of the other things as well, which was mentioned before, was about working, applying for the bank as well. So if you're not having any success applying for the permanent jobs, it might be worth trying to apply for the bank work, which is the sort of temporary staffing work, where you get you can pick up ad hoc shifts, but you can essentially, there's usually enough work on ad hoc shifts that you can work full time, but it might again just be a way to get your foot in the door and get you some experience in healthcare support working. So then it's just around interview tips. So I think more than likely, over the next couple of months, you'll be being interviewed over Zoom, or over a screen rather than in person. So being prepared, making sure you've got your quiet, uninterrupted space, and making sure that you have really thought about a few questions in advance, because generally when you're being interviewed, you're going to be asked some pretty similar questions. And not dissimilar to the application is really knowing and being able to confidently answer why you've applied for the job that you've gone for. So what is it about this particular healthcare support worker job that's drawn you to it? And why do you want to get into healthcare support working when it's a new career for you? Just be really clear on those in advance, and you sort of be a couple of steps ahead before you get to the interview if you've got those clear in your mind. And then again, it's about what attributes you'd bring to the roles. And so your skills that I was talking about before, what jobs you've done before, and how you can use the experiences that you've had previously that you can bring into this healthcare support worker role. And also, what is it about you and your traits that you think would mean that you'd be a really good healthcare support worker? So have a think about, you know, the type of role that you'll be doing, and that you're working one-to-one with patients, and you've got to have a really caring nature, and you've got to be patient, and you've got to really, you know, be confident and comfortable with talking to people. So I think for me, they're my top tips for me when I'm looking through those applications. But really being clear and concise in your application form, so that we can see straight away that you're keen, you're interested in a healthcare support worker role, and it's clear to us why you've applied. I think would put you in a good stead. So lastly, I've just got a couple of slides. Next slide, please, Simon. A couple of slides on, next one again, on what your career options are. And I won't go into too much detail around this. It's just to let you know that, as Jenny has said, as Catherine has said, you know, there are other options for you once you get into a healthcare support working role and you've got your care certificate and you've gained some experience. You might be thinking, well, actually, I really do like this type of work, and I think I might want to do something more. You can go through the apprenticeship route and apply for nursing study if you've got the right qualifications. But if you don't have the right qualifications, you can look to do an access course. And that's building on your current education to get you to a level where you could apply to for a nursing degree. And there's more information on these slides and some links, which I think I'll just double check with the team that we're going to share afterwards. So can I have the next slide, please? The other way you can get into nursing is looking at a nursing associate role. And this actually could be a role in itself as well. You don't need to move on to nursing after you've been a nursing associate. You can actually stay as a nursing associate. And this role is there to bridge the gap between the registered nurse and the healthcare support worker. And recognising that there are some people who might want to move into the nursing role, but don't necessarily want to go all the way into the registered nursing training. So a nursing associate qualification takes up to 2 years and is actually a registered post. So you would be registered with the Nursing and Midwifery Council once you've finished your course. So you're a registered nursing associate, which is similar then to the registered nurse, but just not as such in-depth training. And your role as a nurse associate would be supervised by a registered nurse, but you would be undertaking some of the nursing roles in the patient environment. Next slide, please. And the second last one I've got is going into an assistant practitioner role, and these are roles that are quite that provide you with quite specific skills in a specific area. And is a foundation degree, which normally takes about 2 years to complete. So again, it's a role that you could apply and do your training to get into. And again, it could leave you could stay with that as a career option, or it could be then a step up into going into a registered nursing degree. And then lastly, the last slide, please, is about if you're an internationally registered nurse. And I don't know if we've got any on the call today, but we've had lots of interest in other forums from people who have been trained overseas and were registered nurses or doctors or registered clinicians overseas who want to get into nursing in the UK. And it can be quite a tricky path to try and get into, because there's a number of steps that you need to do. But on this slide here, it can tell you, it tells us how you can navigate the system to get your test of competence or undertake your return to practice training and get into registered nursing. So I hope that's been helpful. I think that's all of my slides now, Clive. I'm happy to take any questions.
Brilliant. Thanks, Kate. Really appreciate that. I'm just conscious that we've got about 4 or 5 minutes left. So I'm going to wrap up the event today. I've seen a question coming through from a lot of people, which is great news on how do I apply for this role. So after this event, we are going to collate all of the questions. I see over 100 questions have been asked, and we didn't get a chance to answer them all. So what we're going to do as a team alongside the NHS is start preparing the answers to those questions. And what we're going to do is we're going to email every single person who's been on this webinar today with, number one, a recording of this event, so that when it comes to applying for the job or your interview stage, and the great tips that Kate gave there, you can then refer back to this webinar to help you guys with your stage of your application and interview. It's also the email gonna include a link on indeed.com with links to the jobs at the different NHS Foundation trusts in London. What they're also going to show is where they're located in London, so that you guys can then pick what's the best area for you. And then also we will have the FAQ and all of the questions in the email as well. Now, just a couple of things. Number one, thanks for coming today. I really, really appreciate all of you spending an hour of your day learning more about the healthcare support worker. And secondly, please feel free, if there's anybody you know that you also think could be a great healthcare support worker in the London region that wasn't able to make the event today, but would be interested, please feel free to forward this email on that we'll be sending to you guys tomorrow morning, and they can then watch it themselves. But once again, I'd like to thank Catherine, Kate, Jenny for coming along and speaking at this event. I'd like to thank Simon and Drew from both Indeed and NHS for their help in the back office, making sure that it ran smoothly. And finally, once again, I would like to thank all of you today for attending this event and showing interest in joining the NHS family. And I wish you all the best of luck in your application moving forward. Thanks, everyone.